Hello and welcome to Dr. Brainwaves. I am Dr. Susan Raschal, and this is my esteemed colleague, Dr. Rena Azar. Today we will be talking about diverticulitis. Some of the reasons why we felt it was extremely important to discuss this topic is because we want you to know what signs and symptoms to look for, because this condition can be extremely difficult to diagnose sometimes. And so one of the things that Dr. Azar shared with me earlier is she had a patient that came into her office that had some of the signs and symptoms of abdominal discomfort that can be associated with lots of conditions, but also had a CT scan, which is an imaging study that shows you in pretty good detail what is going on inside the abdominal area. And it was completely normal. So that's why it's important for you to look at or to record what some of your symptoms are. The other things that we'll be talking about is how can you prevent developing diverticulitis, how do you treat it, and as well as when to bring it to your provider's attention to have it looked at. So Dr. Rena Azar, diverticulitis.
All right, so to talk about diverticulitis, we need to talk about diverticulosis. I'm going to have a picture shown up here. Diverticulosis occurs in the digestive tract. We can actually have diverticula, which we describe as pockets of tissue that form through the layers of the wall in our digestive tract. So the digestive tract, as most people know, includes the esophagus, stomach, and the different portions of the small and large bowel. Diverticulosis loves this area, although diverticula can occur anywhere in here. This is primarily what we're talking about today because it is much more common than diverticular in other parts of the bowel and digestive tract in general. So that is the digestive tract, and specifically if we're talking about looking at diverticula, what happens in the large bowel is that little pockets protrude from the bowel wall. And so these are little pockets that can capture bacteria and food from the gut. And these pockets are a source for infection. And when these pockets become infected, it's called diverticulitis. So diverticulosis is having the pockets, and diverticulitis is having an infection in the pocket. So diverticulosis, we believe, occurs because people can get increased pressure within the bowel. That can occur from gas, that can occur from stool if it moves slowly through the bowel. Diverticulosis is really common, actually. 10% of people above 40 years of age will have diverticulosis, the pockets. 50% of people in their 60s and almost everybody in their 80s will have some diverticular pockets in their bowel. We detect these primarily by colonoscopy, which of course is a screening tool that we recommend, and hashtag colonoscopy, by the way. Colonoscopy detects diverticula. I'm going to show you the difference between a normal bowel right here, nice little tube there we're looking through.
And so that's what, when a colonoscopy is performed, this is exactly what the medical provider will see. Mm-hmm. And so you can see that this is, well, maybe you can't, but this is a completely normal look at the bowel.
And then this is one that has pockets protruding out.
Now you see the little pockets in there?
Mm-hmm. So that's diverticulitis versus diverticulosis, and this is a colonoscopy view of diverticulosis. Mm-hmm. So infection in the pockets has an early stage where food can get trapped in there, and then over time people can have bacteria settle in there. We feel like probably the mechanism for an infection is that the bacteria gets pushed into the wall of the muscular tissue tube of the bowel, and then it will set up an infection. So complications that can occur from an infection, including bacteria, are abscesses, which of course everybody knows is a pocket of pus. People can get fistulas, and fistulas occur when an abscess forms between two body areas, for example, the bladder and the bowel. And then tissue will die in the middle and actually form a hole or pathway through from the bowel to the bladder. That is called a fistula.
Think about it as a tunnel.
Right.
So now these two areas are connected through this opening.
Mm-hmm. And it's a tract where bacteria can pass back and forth, and that is not good for the body. In addition, these abscesses can rupture open because as they build up and get full of pus, the wall of that area gets thin, unhealthy and can rupture open, spilling a lot of bacteria and pus into the abdominal cavity. And people can get very sick because then the pus can go into the bloodstream, spread throughout the body, become a systemic infection, and people can die from that. Another less common known problem that people can get with diverticulitis is they can get a significant scarring throughout the bowel that can cause some obstruction, meaning intermittent times where the bowel actually cannot pass stool through, and people can get very sick from obstructed or scarred bowel.
That's right. And so constipation is going to be an issue. So if you're somebody who never has constipation and then you start developing constipation, that should be a red flag that something is going on that isn't quite right. And then if you have other symptoms that Dr. Azar is going to talk about right now, that also should be a clue that something isn't right.
So abdominal pain can occur frequently for a variety of things. People can get bladder infections, appendicitis. There are a variety of infections that can occur in the abdomen, but diverticulitis is a very common source as we get older for abdominal pain. As you could see from the diagram, most diverticuli occur in the left part of the bowel. So most diverticulitis will present as left lower quadrant pain. That pain will often be associated with bloating, nausea, and vomiting. And also people will often have changes in their bowels, like Susan described, alternating between constipation and diarrhea. I have actually seen people present fairly often with bladder symptoms. So people can get irritation from the bladder that will be very similar to a urinary tract infection because the bowel lies very close to the bladder, and when the bowel wall gets inflamed, infected, and irritated, that irritation can go to the bladder. So as a gynecologist, I have seen frequently people present with bladder symptoms.
One of the other things that I should mention too is that because of being an allergy, people will come in and think they have a food allergy that's causing them to have this abdominal pain or have bloating, distension, and foods can do that, but there usually are other symptoms. And the other thing that is a tip-off that it may not be a food allergy is that they will tell me it's multiple foods that will do that. It's just not one type of food. And when it comes to allergies, so when I'm trying to determine and come up with a differential diagnosis, I am going to be looking at what other symptoms are associated with that. Is it the same food? Is it multiple foods? And when it comes to the adult population, only 1 to 3% of the adult population has a food allergy. And with that, it's only 1 or 2 foods. But if a person tells me it's when I eat or when I am, or it doesn't matter what I eat, these are the symptoms that I get, which is suggestive that it's not an allergy. And then the other thing they will tell me is that they are constipated. But lots of people will say, you know what, I'm not constipated. I have regular bowel movements, but what is regular? And that's a whole nother issue.
Hashtag constipation.
That's right. And so we will be talking more about that, what the stool should look like and what is considered normal and what isn't. But there is a condition in which a person will have stool that gets in their colon, and so it does impair a nice regular movement, but it gets around that blockage, so they're still passing stool, but it may not be the stool that they need to be passing, or it may be different. And that's one of the things that you're going to hear us say always, is that if something is different, if something has always been the same and now it's different, that you want to pay attention to.
Absolutely. So people who are more prone to getting diverticulosis, and also people who are more prone to getting infections in the diverticulosis, are all kind of the same. They're people that they're older, as we mentioned with the statistics earlier, people who are sedentary, people who are obese, people who have high fat, low fiber diet. We're going to go into this pretty shortly. In addition, people that take a lot of medications in the category of steroids, opioids, or anti-inflammatories like ibuprofen, etc. These are all people that are going to be more prone to getting infections with the diverticula.
And also people who don't exercise routinely, because we are designed to move. And even if it's not exercise, even if it's walking, but you want to have some movement, because your body, the balance of your body is extremely important. And so all of those components, drinking lots of water is going to be helpful. exercising routinely, and if you don't exercise with weights and that kind of thing, then you still want to walk the neighborhood or things like that to get everything moving.
Yeah.
And it's well known that the more, not aggressively, but the more frequently we work out or exercise, the better our bowel movements are.
That's right.
So it's extremely important, and that's going to be another hashtag balance for health.
So one thing there is, if you want to move it, move it. Anyway, back to diverticulitis. So what do we do to treat diverticulitis? The mainstay of treatment for diverticulitis is antibiotics, because it is by definition an infection. So treatment with antibiotics is contingent upon how people present. So people who have nausea or vomiting or severe pain, maybe they've had symptoms for a long time, they now have fever and chills. If the infection appears to have symptoms consistent with a systemic level of involvement, meaning throughout the body, then they're going to need to be admitted for IV antibiotics. But oftentimes, we will begin people with an antibiotic by mouth. And as long as a person can tolerate that, we are very successful in treating diverticulitis with oral antibiotics.
One of the things that you also need to be aware of is when we ever put anybody on an antibiotic, we strongly recommend that they increase or begin probiotics, because in the gut there are healthy and unhealthy bacteria. And so what we want to make sure that we're doing is we are enhancing that healthy, because we want to have the most healthy biome or microbiome that we can possibly have. And unfortunately, that's one of the downsides to antibiotics, is that antibiotics don't distinguish from the healthy and the unhealthy bacteria. So it's going to wipe out all the bacteria. The main point is to get rid of the infection in the body, but unfortunately, it gets rid of that healthy bacteria as well, which is why probiotics are going to be so incredibly important under those circumstances.
Absolutely. So sometimes when we see somebody that has recurrent or severe diverticulitis infections, we look at considering having them have a resection of part of their bowel, a removal of the part of the bowel that has a large number of diverticular pockets. And that can significantly reduce the recurrence rate of these infections. So that is a consideration for somebody that's had many infections or severe infections. So let's talk a little bit about...
And excuse me, if you resect part of the bowel, it depends what part of the bowel gets resected, because that doesn't necessarily mean that you're going to be wearing a bag on your side that the stool goes through. So don't panic about that. If the doc tells you that you're going to have a resection, make sure you ask those questions, because all those surgeries do not equal having a colostomy or wearing a bag on your side.
That's a very good point that I should have brought up, that when you have your bowel resected, it's planned, it's scheduled, you're doing it when you're healthy and your body can tolerate it well. And for those procedures, colon resections are generally always not involving a colon bag. On the other hand, if you, for example, have a ruptured diverticula, you have not gotten intervention quickly enough, and now you're very, very sick, and you have a large abscess and an internal infection. Sometimes antibiotics are given to cool the infection, but then that part of the bowel might be so destroyed that it needs to be resected. And those are circumstances whereby the surrounding tissue is so unhealthy that now you actually have to have a colostomy bag. Yes, that's a good point. So an interesting question is, if you have diverticulosis, how do you avoid diverticulitis? So like I talked about before, if you have low pressure in the bowel and increased transit in the bowel, then you're going to prevent diverticulitis as best you can. And that's going to involve having a healthy diet with lots of fiber, fruits, vegetables, whole grains. Exercise helps to increase transit. Fluids help to increase transit and help with the digestion process. You want to avoid smoking. That's a predisposing factor. Obviously, you want to avoid fried foods and refined foods. So sugars and refined grains are all things that are don'ts.
Right.
So I think it's a really important point, because there's a lot of dispute about what can you eat seeds, can you eat nuts? So seeds and nuts are part of eating a healthy diet that can help with transit. We actually have gone back and forth in the literature about whether you can take those types of things orally and tolerate them if you have diverticular pockets. The real message is that if you know you have diverticula, if you know you have pockets, in general, keeping your diet healthy to increase transit time and decrease bloating and gas buildup is going to be healthy. So what does that mean? If you want to prevent an infection, you want to eat vegetables, fruits, you want to limit and modify what you take in that's upsetting to the bowel. For example, it's good to eat lots of grains and lots of fruits and vegetables, but you might want to avoid some vegetables that are hard to digest, like broccoli, cauliflower, Brussels sprouts, cabbage. Things also that can be very gas forming should also be used in moderation, like onion, garlic, spicy foods. Beans, artificial sweetener, and refined things. So those are all things that you can eat, but you want to keep them in moderation.
You'll hear us talk about processed foods or refined foods that we prefer that you not ingest those. And it's not just for preventing diverticulosis or diverticulitis. It's because your body functions better when you eat healthy things. It's like, I talk to people, I kind of analogize it to their car, that you don't want to put crummy gasoline or fuel in your car. You certainly don't want to put sugar down your tank, things like that. That's not healthy for the body either. So that's why it's important to use the right fuels. And I have patients that tell me they can't eat popcorn, they can't eat any seeds or any nuts. And what I tell people is listen to your body. So if you're ingesting something that causes you to have more abdominal pain, it's kind of like what my grandfather in particular would say, if it hurts you, stop doing it. So it's important that we listen to our bodies and that we pull back and then seek expert advice. And again, we have told you on these videos, and we're going to continue telling you, that the information that we disseminate is always going to be medical, evidence-based information, or information that we have gleaned from over 20 plus years of practice that we have seen borne out, but we will also distinguish that from the other. So one of the things for sure is to not eat garbage, to eat healthy foods, because you only get one body. So you want to take really good care of it.
Absolutely. So I'm going to make an interesting point here that I think people don't always recognize. There's a differential between what you eat when you have diverticulosis and you're trying to prevent diverticulitis versus what you eat when you have diverticulitis. This is very interesting. If you have an active infection, if you have an active diverticulitis, you do not want to be eating whole grain foods, fibrous foods, fruits and vegetables, nuts and seeds.
Why is that?
That's because your gut is sick. And it's going to be intolerant of digesting things, and you have areas of infection, and you do not want to have nuts, seeds, etc. getting lodged in that. So whereas if you don't have an infection, those things are actually good for you. Whole grains, fruits and vegetables that are fibrous, nuts, etc. When you do have an infection, when you have an actual abdominal pain and an infection clinically, then you need to stay away from those foods. And that's when you actually eat easy to digest foods. Ideally, if you have an infection, you would drink lots of fluids and stick with clear liquids, maybe full liquids, and slowly advance your diet. So at that point in time, you could introduce carbohydrates, refined grains actually, because now we don't want fibrous, nodular things like nuts in your digestive tract. Once your symptoms have resolved, you no longer have an infection, that's when you can reintroduce the fibrous foods again. So sometimes you're going to need a provider's input about when it's time to advance your diet. And also, like I mentioned before, if you feel like you have diverticulitis, you need to get in and get evaluated so you can get on antibiotics, preferably by mouth, during an early infection to prevent progression to some of those more severe complications. Things that will dictate whether you get admitted or not will include whether you have systemic symptoms, nausea, vomiting, fevers, and chills especially. If you're intolerant of an oral antibiotic, then you need to be admitted. Other things that people need to be aware of is if you have an immunocompromised state, like you're diabetic, you're on immunocompromising medication, or you have some other chronic illnesses that make you not a very good healer or somebody that digests things poorly, then you'll need to be admitted and get your infection treated, because diverticulitis is a serious illness and has serious complications associated with it.
And you heard the results that many people over the age of 60, 50, 60, and 80 actually will have diverticulosis, so they're at risk then for developing diverticulitis. And the important thing for you to know is how to distinguish one from the other, because just as Dr. Azar said, that your diet is going to be very different depending on what you have. And if you have questions about it, discuss it with your primary care doctor. And if your primary care doctor is unable to answer those questions, that's when you go see a specialist, like a gastroenterologist, a stomach doctor, or a GI doctor.
Absolutely. So hashtag biomes as well, because biomes of the bowels are very important.